I'm Christian Radmayr and I'm chair of the Paediatric Urology Guidelines panel. And this is a very special panel because we are dealing with the whole field of pediatric urology. And that means that we do have to cover a lot of different topics. The most important changes in this year's guidelines is that we introduced new chapters. One is dealing with prepubertal testicular tumors and the other one with rare conditions in pediatric urology. And rare conditions do comprise conditions like urachal remnants or papillary bladder tumors or other penile lesions. One of the most impactful recommendations that we do have within our guidelines are those, for example, on undescended testes, because it's so common and it's so important that the testes are down in the scrotum at the age of 12 months or 18 months the latest, because this does have a huge impact for the future of the affected boys, because this reduces dramatically the risk of developing a testicular cancer later on in life, and it reduces the risk of fertility problems later on in life. The areas within our guidelines that changed the most within the recent years is definitively one on the vesicoureteral reflux, for example, and also on other chapters, because the introduction of new surgical methods like robot-assisted surgical techniques is also a great field that affected pediatric urology, although we do not have the instruments available to operate on small babies and things like that. But it's definitively true that that was a huge change within our guidelines, and that was one of the main reasons why we also introduced a couple of years ago a new chapter dealing with laparoscopy and robot-assisted surgery in pediatric urology.